Is whiskey dick for real? I'm Dr. Rena Malik, urologist and pelvic surgeon, and today we're going to talk about, does alcohol affect erections? So what is whiskey dick? Well, technically, it's defined as the temporary inability to sustain or achieve an erection after drinking too much alcohol. Now, it's not specifically just whiskey. It can be any alcohol at all. So I wanted to look at some data in terms of how much alcohol generally is going to cause you to have issues with erections, and at what point should you be worried. Now, what we know about alcohol is that it depresses the central nervous system, which can then put you at risk for erectile dysfunction. We also know that when you're using alcohol chronically, it can absolutely lead to issues with erections. And this is for a couple of reasons. One is because it affects what we know as the hypothalamic pituitary gonadal axis. So this is the part of our brain that sends signals to the testicles to produce testosterone. So what happens when there's damage to that signaling pathway is that you can ultimately cause decreased testosterone and even smaller testicles, or what's called testicular atrophy. You can also see sometimes increased estrogen levels, which then feed back to that axis and cause decreased testosterone as well. It can also affect blood flow because it causes an increase in something called acetaldehyde. And this is a metabolite of alcohol. Now, this metabolite prevents nitric oxide formation in the blood vessels. Now, if you're new here, nitric oxide is the ignition for erections. So when you don't have nitric oxide, you're not going to get erections. So this is more common when you have alcohol dependence. Now, what is alcohol dependence? Well, it's a chronic disease where a person craves alcoholic beverages and is unable to control their drinking because of it. They may also notice that when they abstain from alcohol, they get symptoms of withdrawal, and they may need to drink more and more alcohol to get the same effect that they're trying to get. Now, there's no specific number of drinks that will get you to alcohol dependence, but there is a risk. So for women, if you're having 4 or more drinks a day or 8 or more drinks a week, you're at higher risk. For men, that number goes to 5 or more drinks a day or 15 or more drinks per week. And when we have these issues, it will put you at difficulty achieving and maintaining erections in anywhere from 14 to 20% of men who have alcohol dependence. What if you're just drinking it occasionally? So the initial studies that were done on alcohol were done in the 1970s, and they basically found that high doses of alcohol made it more difficult to have an erection. And since then, however, the studies have shown us something different. And so studies after that found that there was actually no difference in terms of erection quality with alcohol intake. And this might be because those initial studies didn't take into account a number of things. First off, they didn't look at if the person was where they were in terms of intoxication. Was their blood alcohol content rising or was it coming down? And does that make a difference? Secondly, when they told them to get aroused, they typically used the same cue, meaning that if you were sober, they gave you a cue to get an erection. And then when you were intoxicated, they gave you the same cue. And so you can develop a habituation to that stimuli, and it actually may be less responsive when you're intoxicated. The other factor is that people may believe that when they're intoxicated, they're not supposed to have good erections. And your brain is really powerful. So if you think that you're not going to have a good erection when you're intoxicated, you won't. And so these sorts of things were not taken into account. In 1990, so 20 years later, they wanted to look at the effects of acute alcohol on the actual tissues and how tumescent or how hard or firm the erection gets in young men and dogs. But we're going to focus on the young men. So they recruited 11 subjects, and these 11 subjects were baseline called light to moderate drinkers, but this was defined as 7 to 21 drinks a week at baseline. They were on average 24 years of age, and they then monitored them over 3 consecutive nights, and they wore these devices that would measure the expansion of their penis over the course of the nighttime, and they measured their nocturnal penile tumescence, or the erections at night. And so they did this over 3 nights. The first 2 nights were without any alcohol. So normal activities, normal soberness. And then on the third night, they gave them a fixed amount of alcohol. And how much was that fixed amount? Well, it wasn't a specific number of drinks, but they wanted to elevate the blood alcohol content to a level of 0.12 grams per 100 milliliters. And that's significantly higher than our current legal limit of your blood alcohol content if you were going to drive a car. And so generally people are having slurred speech, maybe their cognition is a little slowed. So we know that they're definitely having an impact of the alcohol on their body. And the way your body responds to alcohol is different from person to person. So for an average person, it might take 5 or 6 drinks to get to that blood alcohol content, but someone who metabolizes alcohol more slowly or is a little smaller, it may take a little less. And someone who's bigger or metabolizes faster, it may take more. And so in this study, the first 4 subjects who got to that blood alcohol content and were followed at that night noticed that they didn't see any difference in terms of erection quality on the night after consuming alcohol. So for the rest of the 7 subjects, they increased the blood alcohol content to 0.19 grams per 100 milliliters. And so when those patients had that high level of alcohol, they found no impact on the amount of sleep the person got, the number of erections they got, the increase in penile circumference, and the maximal penile circumference. So ultimately no difference, even though these people were very inebriated. Now this is just during sleep, right? They didn't look at them during awake and having a response to an erotic stimuli. So then in 2006, another group wanted to look at really high blood alcohol levels in awake patients. So for this study, they recruited 65 men who were already moderate drinkers, and this was on average 17 drinks a week. And all the participants were shown a 2.5-minute documentary about birds to start off with, followed by 2 different erotic films. And they then measured arousal using penile plethysmography. And that's essentially a measurement of the penile circumference again and girth enhancement during an erection. And they then asked them questions as well about their self-reported rating of arousal. And they measured these men. They wanted them to reach a blood alcohol content of 0.1. And so they did that. They measured every 3 minutes to make sure that they were getting them as their blood alcohol content was rising and not coming down. And in this study, they found that the men who did have the higher blood alcohol content of 0.1 did reach a lower peak circumference of their erection. So they did notice that it didn't get as firm as it does without the alcohol. Now, there was no difference on self-reported arousal. So while they found the erection didn't achieve maximal girth, it still didn't feel less arousing to the individual. So they also did a second arm of the study, and in this study they went to a lower blood alcohol content of 0.08%. So these guys were also young, on average 25 years old. It was 60 men, and at baseline these guys drank about 14 drinks per week. And ultimately, they found that there was no significant effects at that 0.08 target blood alcohol content when comparing the sober group to the intoxicated group. Now, moving on, in 2007, they did a meta-analysis. So a meta-analysis is combining a bunch of studies, and these were population-based studies. So looking at people who were drinking alcohol of a certain amount and seeing if that correlated with erectile dysfunction. Not specifically erectile dysfunction in the moment of drinking. So it's not the exact same question, but nonetheless, it's helpful, right? If somebody was drinking pretty moderately and they often had issues with erections, they would probably say, yes, I do have erectile dysfunction. So they had 11 studies. Some of them, they asked the participants, did you use alcohol, yes or no? In other studies, they looked at how much, and they categorized them as having less than 1 drink, 1 to 7 drinks a week, or 8 or more drinks per week in terms of how much alcohol they consumed over the course of the week. And what they found was that men who had regular alcohol consumption or had an average of 8 or more drinks per week were not associated with erectile dysfunction. Now, very specifically, they point out a couple studies. The largest study looking at lifestyle factors and the correlation with erectile dysfunction is called the Health Professionals Follow-Up Study. And this followed about 31,000 men between the ages of 53 and 90. And what they found was that erectile dysfunction was decreased in men who had moderate levels of alcohol intake. Now, again, this is correlation, not causation, but they did adjust for things like medication, smoking, physical activity, and body mass index. Again, another sign that maybe alcohol is not problematic. In another large cohort study called the Massachusetts Male Aging Study, this was smaller. It looked at about 500 men without erectile dysfunction at baseline. And they categorized men in terms of how much they drank. And so if they drank 1 drink, 1 to 3 drinks, greater than 4 drinks a day, the incidence of erectile dysfunction remained relatively stable. So from this study, they basically said alcohol consumption is not related to erectile dysfunction. And it may follow what's called a J shape. So at lower, moderate amounts of alcohol, you're not seeing a negative impact. But once you get to those higher levels, as I mentioned earlier in the video, you're going to start seeing detriment in terms of erectile function because of the long-term effects on testosterone and as well as nitric oxide production. Now, there's some limitations in all of these studies, right? One, if you're looking at population-based studies, the people who choose to not drink alcohol may already have erectile dysfunction, and they may say, you know what, I don't want to deal with the issues of drinking alcohol and having issues with my erections. And these studies were not only in the US, they were in South America, Europe, Africa, Asia, and Japan. So these studies may not be generalizable to individuals in the United States. Bottom line, I think the point of this is that, yeah, whiskey dick can occur probably when you're really, really intoxicated or if you're a chronic drinker. However, if you're drinking casually or moderately, it's probably not a huge issue. Now, I will never encourage anyone to drink. I don't think it has any protective health benefits based on the new data, and in fact has some correlation with cancer. And so there's really no safe amount of alcohol consumption, but if you are going to consume safely. Try to stay within the limits as recommended, which would be less than 2 drinks a day for men and less than 1 drink a day for women. But I would say ideally, as minimal as possible, try to stick to 2 drinks or less a week if you can. And I hope you guys found this helpful. If you did, please let me know in the comments below. And as always, remember to take care of yourself because you're worth it.